Welcome back to Taiwan is Helping, the program where we show how Taiwan has been assisting other nations, particularly Latin America and the Caribbean, and especially during the COVID-19 pandemic. ICRT. I'm joined today by Tony Wu of the Taiwan International Cooperation and Development Fund. Mr. Wu has done some fantastic work helping to improve healthcare infrastructure in Paraguay. Tony, how are you doing today?
I'm great. And you?
I'm great, thank you. So let's start off with the most basic question. What inspired you to begin working to improve Paraguay's healthcare systems?
Honestly, at the beginning, I was designated by Taiwan ICDF, because of my background is in IT. Yeah. So they assigned me to, work as a project manager for this project. But then later, after I got here, I started to realize how much of impact my work could bring to the country. Yeah.
Okay, you've actually produced a video showing the work you've done in Paraguay, and it looks like helping establish an HIS was both one of your biggest challenges and one of your biggest achievements. Could you explain what an HIS is and what the state of information storage at hospitals was like that you worked with beforehand?
Okay, HIS stands for HIS, Health Information System. It's an integrated system for the entire hospital's operation, like from admission, pre-consultation, consultation, pharmacy, and we also introduce some administrative functions like to generate various reports for the managers. And when I first got here, basically all the hospitals, they were all handwritten process, right? And as a result, like the record are easily lost or damaged. So when a patient, like many times I've seen like a patient, they go to the hospital, they wait in the queue, the admissionists start looking for their records and they couldn't find it after 10-15 minutes standing there. So the patient has to register as another new patient, Yeah. So that was how it was like at the beginning. Yeah, without the HIS. Yeah.
So now patients never have to re-register and everything goes quite smoothly over there?
Yeah.
That's great. So as a Taiwanese person, did you seek to impart some of the healthcare systems that Taiwan has on Paraguay, or did you find that you needed to develop a new healthcare system for the country specifically?
Okay, thanks to the national health insurance in Taiwan, we have very mature HIS industry, right? And then we actually use Taiwan's experience to develop a new HIS for Paraguay. Because I believe if we simply translate what we have into Spanish and just put it here, we're not going to get this far. We are basically not going to make it because the system in Taiwan is very complicated. And the environmental factor is quite different, like the level of, work, like the level of education in terms of computer literacy, and the workflow is very different. The culture is very different. So we decided to do it the hard way, which is also the best way. Like we analyzed their workflow from the beginning, and we developed a HIS from scratch with the people here. So they really love the system because they feel they're part of it. That's also one of the factors that helped us to smoothly implement the system. Yeah.
Okay. What are some of the differences between Taiwan's HIS and Paraguay's?
Put it this way, because the HIS in Taiwan, right, we have to send many specific data to the central government to reimburse the fees, right? And they complicate things when it talks about money because in Taiwan, we have to do a lot of process to ensure the system is fair. No one can overclaim, But here in Paraguay, it's actually quite simple. We just have to focus on the operational level. Of course, we have to do something, try to, control the drugs because here there's a very special thing like the government in the public hospitals, basically, there is no consultation fee. patient doesn't need to pay for drugs. Yeah, so there's basically no charging system. Yeah, but then it also brings up a factor where the drugs are usually abused here in Paraguay. So we just have to develop some sort of mechanism to allow the hospital to, trace the situation. Yeah.
And is a digital healthcare system now implemented countrywide across Paraguay? Or are there still some areas where it hasn't reached?
There are still quite a bit of areas that we haven't reached. Paraguay is like land size wise, it's 11 times bigger than Taiwan, Yeah, so it's a very big country, but the population is low. And but it has become a national policy that we must implement HIS to the entire public hospitals in the country. We've covered about 30% so far.
Okay. You already mentioned that patients having to re-register was a problem before. If I were an everyday citizen in Paraguay, are there any other ways going to see a doctor or visiting a hospital for a checkup or procedure would have improved after you helped implement the HIS there?
Yeah, of course. Like one of the first thing is the waiting time before HIS. Honestly, like you won't even believe it. It's hard to imagine, like in some hospitals in the rural area, right? Patient has to get up at like 3 o'clock in the morning, go to the hospital start admission process at like 6 o'clock, and the doctor start attending patient at 8 o'clock. And like, that's when you start waiting, like that's when the hospitals start to calculate waiting time for the patient, right? And like from 8 o'clock, if you're lucky, you can finish by like 9 o'clock. So, but in average before HIS, right, like it usually takes like 3 hours for an ordinary person to complete their consultation. But with HIS now, it's like less than 40 minutes. Yeah.
Okay, that's great. So how are you ensuring that an effective HIS is sustained in the country and will continue to function into the future?
Okay, that's a very important question, actually. Like the spirit of our project is about skill transfer. We want to transfer our know-how to Paraguay. And Paraguay, from right at the beginning, they have to allocate resources to implement the system. Like they have to allocate resource to improve the hospital's infrastructure, like ICT, the information communication technology infrastructure, like cabling, put up server rooms, make a proper server room, install aircon, and get the computers. So from right at the beginning, we want to make sure Paraguayan side is capable of allocating the resource to maintain the operation. And in fact, like as we expand, right, like honestly, my side, it's like 3 Taiwanese, including me, with 10 local Paraguayan from my side, from the project side. And we work with the government. And as we expand, my side, the number of our people, it's not increasing at all, because we train the hospital side to handle their own operation. So they are capable of troubleshooting and ensure the system they can continue to operate.
What would you say was the biggest challenge you faced implementing the system in the country?
At the beginning, right, it's all about change management, I would say. Like people are not used, and they actually don't believe that this system is going to work. So we have to do lots of communication, lots of training, and lots of like practice, like what if this happened? How do we handle the situation? Because doing it by pen and paper and doing it with computer is like totally different. And there were quite a bit of bad experience before, like the government always tried to implement some system, and it didn't really work out well. So I still remember when I went to the first hospital, right? I was telling them what we were going to do with them. They were like, the way they look at me, I couldn't understood like why they look at me like that. Later, I understood, like, it was like, again, another system. But then we work together, and now they really love it because they feel they're part of it, and we listen to them. We continue to improve the functionalities. Yeah, so that's where we are now. Yeah.
Okay, you're working with Paraguay to ensure its healthcare system can effectively deal with the coronavirus.
In February last year, right? There were 170,000 consultations made through HIS. And then March, that's when the pandemic started to hit Paraguay. The number of consultations dropped down to 90,000. And then the next month in April, it dropped down to 40,000. That's like a quarter. All right. So we were like wondering what's happening. Of course, it's part of it is because of the strict lockdown policy, right? And which, like, there were a lot less accidents, like a lot less patients that would go to the emergency area, right? And then there's another serious matter that we identified, which is the patients with chronic disease or elders. Even if they are sick, even if they are supposed to go to the hospital, but they don't dare to go to the hospital because of they are afraid of being infected, right? So that's when I start to think how we can help the people here. Then I discussed with my doctor friends. We came up with an idea of teleconsultation. Okay, in Paraguay, we don't have good infrastructure like Taiwan. We cannot do video conference like for teleconsultation. So here we just use telephone. So we modified the system a bit, which allows patient to make an appointment with the hospital side or over the telephone, right? And when the time comes, doctor will just call them and attend them through the telephone. And once they finish the consultation, the patients, they're afraid of going to the hospital. They don't even want to go out, right? So what happens is their relative can take their ID to the identified pharmacy to get their drugs. And until today, like we launched this teleconsultation system at the end of May last year. And until today, there are over 40,000 consultations made through this mechanism or platform. Yeah.
Is it still easy for doctors to diagnose problems via teleconsultation?
That's a very important question. And I would say for teleconsultation, it's not going to be able, we cannot apply it to or replace it with all the, face-to-face or physical diagnose, right? Only particular services or specialties can use this function. Yeah, and doctors, if they sense there's something wrong with the patient, doctors can advise the patient to go to the hospital for, checkup, for the real checkup.
So it's the best solution for the current times.
It also helps with the doctor. Some elder doctor, they don't want to work in the hospital as well. They can actually work from home and call the patient, right, to provide the consultation service.
So it's convenient for both sides.
Yeah.
Okay, what feedback have you received from the people of Paraguay about your work?
I think they're all quite happy, like from the central government side. They're able to, put it this way, before, right, the handwritten process, it would take like 2 months for the government to get the information because they have to, collect the paper, enter it to the, system. And like it takes time to finish entering those data. So the data government had was like 2 months old. And it's difficult for the government to make the right decision or allocating resources, right? So now with HIS, like government can get the right information real time. And for the hospital side, the overall productivity has improved. I remember the first hospital, that we implement HEAS, they were able to attend like 80% more patients with the same human resource, right? And then the hospital manager, I still remember one of my friend, one of the directors, she told me like, Tony, this system really makes me a real manager now. Because before it was impossible for them to know the productivity of the doctors, and don't even think about where the drugs went to, you know. Yeah. So they are capable of knowing the real situation, and of course for the patient, less waiting time. Yeah, they're all very happy from my observation. Yeah.
That's great. So finally, what future plans do you have in your continued collaboration with the country? And are there more challenges Paraguay's healthcare system faces that you think you can help the country tackle?
Well, first of all, we're going to continue to expand the system. And currently, our system only covers the outpatient area, right? And now we are trying to implement the inpatient module to the hospitalized area. So this will allow the hospital to be fully digitized. So the hospital really, they will have the entire control of what's going on. And then like we recently developed a very cool function where, because Paraguay, besides COVID, they used to have a very serious issue with dengue. Like dengue outbreak was quite serious, right? So we developed a function where certain diagnose that's related to arbovirus, like mosquito-related disease, right? The system will pop up additional form for doctors to fill, and this information would send to like the CDC in Paraguay directly. So we want to develop more of these type of functions, like bit by bit. That's another thing, like data exchange, you know. And then speaking of data, we want to conduct more researches with the data collected by HEAS. In fact, this year, we have submitted 2 papers already to journals. And then one of my friend, Paraguayan friend, he has recently been appointed as the vice minister of a ministry that controls all the researching budget. So he called me right away, hey, Tony, we got to do something together. So yeah, for sure, we'll even try to form a data science team that can improve the overall health care for the country.
Okay, well, thank you for joining us today, Tony Wu. If people want to find out more information about the International Cooperation and Development Fund's work in Paraguay, where can they find it?
I'm sure our company's website has all the information, Taiwan ICDF, just Google for it. Yeah. And our project also has a Facebook fan page. Yeah. So, but it's in Spanish though. Yeah.
Okay, great. Thanks again for joining us today.
Thank you.
And don't forget to tune in to Taiwan is Helping next time, where we'll be back with a new guest on ICRT.